Hi, Assalamualaikum. In our CSR project, our group will share to you about COVID-19. We will talk about what is COVID-19, how it will affect human in short and long term, how to handle your mental health during COVID pandemic, and ways to prevent COVID-19. We also make a poster for social media awareness. Also, we collect some feedback from YouTube audience about their experience with COVID. What is COVID-19? It stands for Coronavirus Disease 2019. It is a disease caused by a virus named SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome (SARS). COVID-19 was discovered in December 2019 in Wuhan, China. COVID-19 is very contagious and has quickly spread around the world. COVID-19 most often causes respiratory symptoms that can feel much like a cold, a flu, or pneumonia. COVID-19 may attack more than your lungs and respiratory system. Other parts of your body may also be affected by the disease. If a high-risk person got infected by COVID-19, the person have a higher risk of death, as COVID-19 can be compromise the oxygen intake of the person. If the person has an existing serious health problem, they are more likely to fall in the high-risk group. If this group infected by COVID-19, they will be under a strict supervision by the doctors in the hospital.
Hello guys! Now, I will approach the topic of the short and long-term effects of COVID-19. I start with the common symptoms of COVID-19 such as fever, loss of sense, sore throat, headache, and difficulty to breathe. These symptoms are usually from the first day until 6 or 7 days. These symptoms can be cured by using clinical medicine. For the long-term effect that occurs after 1 or 2 months after patient get positive in COVID-19, based on the information from the respondent that fill up the Google form, they still have the side effects from COVID-19 such as heavy breath, lost appetite, tiredness, chest pain, and cough. This is because COVID-19 virus attack our lungs and respiratory tracts. So, I hope all of us can prevent getting COVID-19 because prevention is better than cure.
Managing our mental health during the pandemic, firstly, we must stay connected with family, friends, and a trusted support. During the pandemic, as we know, it is important that we do our best to take care of ourselves, check in on our loved ones, and find ways to remotely socialize with them. In order to do this, we can schedule a regular calls with friends and family, and if we can, make a video call through FaceTime, Skype, Zoom, or other video calling options. Next, we can take a break to relax and do activities that we enjoy. During our normal day, we might feel mentally pressured due to the excessive workload and a long hour of work. Therefore, during the isolation, it is the best time to clear our mind with various activities such as painting, listening to music, and watching some movies. Lastly, we can take care of our body with exercise and a healthy diet. By doing regular exercise such as aerobic dance and workout, it will help lower our blood pressure and stress hormone. Other than that, when we eat a healthy diet, it will eventually provide our body with extra energy to cope with stressful events. As people say, a healthy body leads to healthy minds.
Hi, I'm Haziq. So now I will explain about ways to prevent the COVID-19. So in order to prevent the COVID-19 from spreading, we have to practice 3W, which mean firstly, wash, wear, and warn. So firstly, for wash, we have to wash our hand oftenly with soap and water at least 20 seconds to prevent the disease, or we can use the sanitizer every time we touch something that people oftenly touch, like button in the lift and escalator, so that we can prevent the spreading of bacteria or COVID-19. Next, for the wear, we have to wear face mask, which it limit the volume and travel distance of expiratory droplets dispersed when talking, coughing, and sneezing. So, it can protect us from virus inhaled air. Then for warn, which it means that we have to be careful by avoiding shaking hands with people and cover our nose and mouth with tissue when cough. So we will not use our hand, as our hand is a place that very easy to touch something that it will spread the virus easily, like just I stated just now. So that we can prevent the spreading of COVID-19 easily.
This is our site activities for awareness in COVID-19. We use poster to spread out about COVID-19 through media social as it can reach a big amount of people. Also, we have posted the video on YouTube to gain some feedbacks from the audience.
During our research, we collect some public audience to fill up our Google form to share their experience live with COVID-19 virus. From the feedback of each respondent, we collect some data from the Google form. As you can see, these are the questions that we ask in the Google form.
Next, for other question, what is your COVID symptom? So mostly they choose non-symptom, as most of the feedback is from teenagers, and the list is body pain, about 5%. Next, what do you do during COVID infection? So they choose take a medicine, about 85%, and the rest they choose to rest, about 3.0%. Then, what is your initiative during COVID infection? There are a lot of choices, like take water, medicine, supplement, but most of them choose to rest, about 19.2%, and others choose to be active, about 5.1%, the least. Then, how do you know about COVID information? So most of them choose social media, as social media is the most wide platform that we can use to know about COVID-19. And others like MySejahtera, about 23.6%. And MySejahtera is a Malaysian application that we use to know about COVID and statistic COVID of Malaysia.
From this pie graph, we can see the big amount of respondents have get their booster vaccination. As we know, vaccination is important because it can give a big effect to our health and shield from COVID-19 virus. As a mini conclusion, we suggest to all the people to take care of their healthcare very seriously because COVID-19 effect is very dangerous.
Hello, I'm Ainadira. Previously, you have known what is COVID-19 and how to prevent it, right? To wrap up, yes, COVID-19 can spread by droplets. COVID-19 transmit when people breathe in air contaminated by droplets, small airborne particles. The risk of breathing in this is highest when people are in close proximity, but they can be inhaled over longer distances, particularly indoors. Not only that, people need to monitor the signs and symptoms include respiratory symptoms and include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, and sometimes death. Next, people always need to use masks, especially in public spots. Universal mask use can significantly reduce virus transmission in communities, but masks are not perfect barriers to transmission. Should be combined with other preventative measures such as social distancing and contact tracing. Physical distancing helps limit the spread of COVID-19. This means we keep a distance at least 1 meter from each other and avoid spending time in crowded places or in groups. We do not always know who may be sick in coronavirus. That's why it is important to stay home and follow the home surveillance order when you have any symptoms of COVID-19. So that's all from us. Protect yourself and others, break the chains of transmission.